Hi, my name is Devon. I have chose a central line dressing as my thing I will validate on today. I'm going to go ahead and provide privacy, and then of course wash my hands before I come into the patient's room. I've already verified doctor's orders, and I'm going to come in and introduce myself to the patient. Hi, can you tell me your name? Okay, nice to meet you. My name is Devon. I'm a Cedarville nursing student, and I will be doing a central line dressing change on you today. So I'm just gonna take off that dressing, just make sure that there's no infection or anything going on, and then I'm gonna put a new dressing on there for you. I've gathered my supplies and checked the physician's orders, and you're all ready to go, and I've ensured adequate lighting and made sure all safety precautions are met. So I'm gonna go ahead and raise the head of the bed. How are you today? Okay, and then I'm going to have you turn your head away from the side of your dressing, if that's comfortable for you. And I'm going to raise your head of the bed up just a little bit. Okay, I'm just going to grab some clean gloves really quick, and I am by my patient so they are safe, even though the bed rail is up. Okay. So with the patient's head turned, I'm going to go ahead and open up my tray. I'm going to put my mask on. Normally I would put it all the way across my face. And I'm going to go ahead and take out my sterile field. This can be used as a trash can for the old dressing. I'm going to go ahead and put on some clean gloves. And then again, I'm watching my sterile field just to make sure that nothing happens to it and it remains sterile.
This is a clean procedure, so I'm going to be ready to begin.
So I'm just going to go ahead and look at the hubs of the line, and I'm going to notice what way it was inserted. So I'm going to pull the bandage away from the way in which it was inserted. I'm going to slightly loosen the bandage. Okay, so now that the tape is up, I'm going to peel away slowly in the direction in which it was placed. I'm going to go ahead and look at the dressing, see if there's any drainage or anything dirty on it. And then I'm going to look at the site, and I'm just going to see if there's any inflammation, swelling, redness, anything that would alert me to a sign or symptom of infection. While the dressing is off, I just want to make sure that nothing is touching because it could cause an infection, and make sure that the patient isn't coughing or breathing on it. I'm also going to assess the line and the hubs to see if there's anything going on that they're still intact. Okay, so I'm going to remove my gloves, and I'm going to go ahead and wash my hands in between. And now I'm ready to open my sterile kit. I'm going to put my sterile gloves on. dominant one on. Okay, and it did roll, so in the real scenario, these gloves are a little bit too small, but in the real scenario, I would have gotten new sterile gloves and got a new kit, and so I could start that. Okay, so at this point, my hands are sterile because I did go and get a new set of gloves like I would have. I'm going to take my chlorhexidine swab. I would snap it to release the fluid, and then I would scrub for 60 to 90 seconds without lifting it up. Okay, and then I would let it dry. I'm not going to blow on it or anything. Okay, now that it's dry, I can take my new dressing. And then without touching anything and remaining sterile, I'm going to cover the area. I'm going to take tape and make a window pane around the dressing. And at this point, now that it's covered up, it's just like clean technique. Just making sure that it's occlusive. I'm going to document date, time, initials, and then just document on the flow sheet that there weren't any signs of infection or any complications. And then I'm going to lower the bed down, put all the side rails up, ask the patient if they need anything, give them the call light, do anything I can for them, make sure everything's safe.